Started. This is male infertility, and I would like to introduce Dr. Najia. He's from KU Medical Center, and he'll be doing the presentation.
Well, thanks, everyone. Well, I have a couple of disclaimers. I'm a guy. That's the first one. Second is that just by being in this room doesn't admit to anything. Guys have a thing where we have to talk about things that we're not used to talking about. There's a degree of denial that we all have to deal with. Being a guy, I can say these things. It makes you feel a little squirmish about talking about reproduction, and you're sitting in a room with a bunch of other guys, and does that admit I have male infertility and I'm machismo and all of that kicks in? No. The problem is, this is a couple's problem, and that's why I titled this a perspective for couples. And I'm so glad for those of you who've brought your wives and spouses and stuff, because one of the topics that I want to talk about is that getting through the doorstep, which is very hard for some guys. Right, why am I even here? Why am I even talking about this stuff? I'm a card-carrying guy, and I'm a card-carrying male infertility specialist. And what that means is I'm a urologist who specializes in maleness, men's health, sperm. I never tell my family what I do for a living. And what you have to understand is the magic of reproduction takes two, right? And it takes two, whether inside the body, in vivo, or outside the body, in vitro, which is what some of the specialists here are talking about. But the thing that is why I'm here, and I have no vested interest other than in your health, because I'm a salaried employee at KU. I don't own an IVF center. I am here for you. It doesn't matter whether I see 1 or 50. I'd prefer to see 50 people in a clinic rather than one, but that's because I'm here for you. And why am I here for you? It's because 50% of infertility is male. How about that? That's not just a number that I just created because it's men and women 50-50. It's because you'll see the numbers in a minute. Even for in vitro, there's a thing called the Society for Assisted Reproductive Technology. If you ever want to look up numbers, success rates, which is unfortunate for the IVF centers, how well they're doing, then look up SART, SART.org. Well, we just wrote something for the next national meeting about how common is male factor for IVF. Nearly a quarter of IVF is because of male factor. All right? But what does that even mean? All right? What does that mean? First of all, if you look at the causes for infertility, traditionally we used to think in the Victorian era that it was all the woman's problem. It was all the woman. Barren woman, barren, barren, barren. Right? We know that's not true. Okay? Admittedly, 30% is pure male. I think that's underrated, but that's because of the way that definitions occur. I think it's underrated. But the other part is it's sometimes both, right? And then that gives you a male component of 50%. But that's why it's important not to just plug away at the woman and get her worked up and do all these tests and dye tests, and it's just not fair. It's just not fair. It's not fair to the females, and it's not fair to you as a couple. That's why we have to very much need, have the guy evaluated. But what does it mean? Firstly, in the US, it's the inability to get pregnant for 1 year. In Europe, it's 2. All right? They have a mandate, though, which means they get coverage for IVF, which is the other soapbox I'm on, which is trying to get infertility as a covered benefit by insurance companies, and that's a long story in of itself. But needless to say, infertility in the US is the inability to achieve pregnancy by 1 year. Now, you may say at 6 months, we're getting itchy feet, we need to be worked up. Yes, that's your prerogative. If you're 40, you might do that sooner. I would hope you do, because it's sometimes important before, by the time the workup is done, you're already on the launch pad by 1 year, not starting at 1 year. Now, the other thing is, what does the other definition of male infertility? An abnormal semen analysis. Sorry guys, we've been resorted to just being a semen analysis, which is not true. But it's important to know what you're dealing with, and this is why you guys and ladies are empowering yourself. These are the normal values that have been devised by the WHO, World Health Organization. These came out in 2010. They have changed things a little bit. There were values from 1999. these have dropped even more to say these are what are defined as fertile. And we've just done a study to show that 15% of men who would have been abnormal by the old criteria are now fertile. Well, again, the definition is not a number, it's the length of time that you can't achieve a pregnancy. But when you look at your semen analysis results, guys or wives, you know, you see the L's and you see the H's and you go, oh my God, you know, this is the problem. Well, first of all, you have to know what your reference ranges are, because if you don't know what they are, then everything else is irrelevant. But that's what I do for a living, that's what the REs, the reproductive endocrinologists, do for their living. But here's another scary thought. I got sick and tired of seeing, if you pardon my French, crap semen analysis, that I decided to look at the national database and say, right, if we took well not every, but as many semen analysis labs as we could, how many actually follow the criteria? Only 11%. So be careful what you read, is what you have to be careful with in this situation. Most of the RE labs, reproductive endocrine labs here in the city, of course, do follow certain guidelines, but they'll mix and match some of the old numbers with the new numbers. We do, and I don't care for that. I'd like to go with the new numbers, but bottom line is you have to be empowered, and just by being here today, you're empowering yourself. All right, you heard it from Nicole. I thought that was a phenomenal support message. It's all about you. It's your journey. It's individual, and you should help yourself know what the facts are, and don't believe things on the internet just because they're there. All right. Now, the one thing that's making this very difficult for you as a couple, and for me, but I can get into the science of this, but it's not my job, is that just because a guy has a normal semen analysis does not rule out a male factor. All right? It's an easy way to say, all right, it's not a guy thing. And that's all right. It's always going to be a couple thing. It's never just going to be a female or a guy thing. That's never the way you should tackle infertility. And the important thing is that's where it's hard for me as a clinician, as a scientist, to put that into perspective for couples sometimes. Because it's sometimes the way that the DNA breaks, it's kind of fragile, even though you have a normal sperm count. It's sometimes the way the sperm finds the egg. You don't see that from a count. These are things you can't measure very easily. So there are all these subtle ways, and some expensive tests, which we don't always do, that we can test for these kind of abnormal sperm function things. But the treatment many times is what I will tell you when we get towards the treatment phase of this talk. It doesn't matter. If you think there's an abnormal sperm function, then there are methods to overcome it without sending you for the test, if that makes sense. And remember, and this is why I'm always on my soapbox, the guy is not a sperm count in a cup. There's a book out there which I thought phenomenal. You know, having sex with a plastic cup. I'm like, God. Now let me tell you my journey. We had infertility. I was blessed to be a physician, I was blessed to be a urologist, and I was blessed to be able to do this for a living. But we couldn't have kids for 3 years. My wife has endometriosis, and I was a resident, and long hours, and all the rest of it. And it didn't bother me for the first year as a guy. It started bothering me after the first 2 years. For my wife, she'd look at anyone with a kid, and she'd burst out crying, and it was just getting too much. So we got help, and we ended up with superovulation IUI after laparoscopy. We now have triplets. And so be careful what you wish for, it's another message. Right? And our first child was through flushing her tubes and the laparoscopy, and we got pregnant naturally with the first one, but only after intervention. But the second took superov IUI. So if anyone like Nicole and Tammy and all of the others in this group, in this support group, have a message and a mission, I have one too. And I swear to God that I'm on your side every single time, because I've lived it, I've walked a mile in your shoes, and I've come out the end of it, and I have been blessed to be in a position to talk to you and help you. That's a powerful life message for me. So, but guys are not a semen analysis. God, I cannot tell you how many times I say that to people. And I don't want any gynecologist to treat you as a couple like that. And I'm very, again, fortunate with all the 5 groups in town, they don't. And they're getting the message as well about male factor. But the fact is, I've been on the bandwagon a little bit on that, all of those things. Because the social aspect of this, whether you believe single mothers, not single mothers, I'm not even going to get into that political argument. But the fact of life is that to get through your journey, as tough as it is, it takes both of you. All right? It is one of the most stressful things for a young couple to do. First job, first house, first baby. All right? first expensive baby if it involves in vitro. All right? So you are a team, and you need to get through this together. And that's why the guy's not a sperm count. All right? Because you are each other's sounding board and each other's support group. I would argue, guys, that most commonly it will come from the woman, and then you have to be the receiver of that, and you have to support her back, because most of the treatment, as you will see in a minute, unless you have zero sperm count, will lead to the woman having most of the workup. So it will make or break your relationship, sadly. All right? And that is the hardest thing I've learned from being not only on the side of infertility, but having triplets. You know, Kate plus 8, guess why John's not around? You know, Optimum, never had a partner, right? Whatever her situation was with putting 8 in, stupid. But now she's on welfare or whatever she's on, or TV, or I don't know what she's on, but she's needing support. So whether we like it or not, having children is a support group. Having children together is a support group. Raising a child in this situation, not to be politically incorrect, but I have to say what I think, is it's a support group. You are supporting each other, whether it be a singleton or a multiple, and definitely if it's a multiple. And my marriage almost went on the rocks a couple of times because of me. Not because of anything bad, but just the frustration and the stress of raising multiples. If you ever want me to tell you what I exactly think, I'm not a fan of multiples. There it is. There's a conflict of interest right there. I am not a fan of multiples. I have multiples and I don't wish it on anyone, but I actually am truly blessed. And so for all of you trying, I've been there, we've been there, I know exactly what, you'll take it however it comes. And I hope they're healthy. So that's the bottom line, is I'm happy, I can't complain, and really the complaining is minor in relative terms. So why again am I here? Because I truly believe that male infertility is not just the act of having children. It's a men's health issue. Why do I think infertility should be a covered benefit? Because most times, unless you had a tubal ligation or a vasectomy, you did not plan it. It didn't just happen to you because you wanted a boob job, all right, or something. This happened to you because of some dysfunction that nobody knows why it is, that led to you having a factor, whether it be male or female. So that's why I will always challenge government. I'll challenge it on the CDC level, and they're on board, by the way. I work with the CDC, and they're on board with this. They just can't get the message in front of economic distress that's going on in the country. So my mission and your mission as a couple is to make sure that you get evaluated from the male standpoint, to make sure you don't have something else going on, right? Unfortunately, the reason why infertility is not a covered benefit many times is because it's aesthetic. Why? Because having a kid is a choice. It's not a disease, but that's nonsense. You know, it's like having coverage for erectile dysfunction. It's a psychological barrier for the couple. And what do you think infertility is? How can that be covered? It's because Congress is a bunch of guys. It must be single guys because they're not married, obviously. I don't know what the hell's wrong with them. But the point is that they don't understand. Oh, it's old guys. They've had their kids and don't care anymore. But the point of it is that it's a disease. And this is why I speak to you, I'll speak to anybody, about why it's important. Because at certain points, certain things will show up that will affect the rest of your life. Diabetes, hypertension, erectile dysfunction, a history of testis cancer, or even finding you for testis cancer. History of pediatric disease, and I've spoken about that at Children's Mercy. I've talked about it everywhere around the country. But pediatric diseases that you never knew when you got married, that somehow they would rear their heads up again, right? Because now you can't have a kid, you had an undescended testicle, you had hypospadias, which is where the pea tube doesn't come out quite to the tip of the penis. You've had surgery down there. And the wife didn't know that. You didn't say that when you were getting your first drink at a pub or anything like that. Hey, by the way, I've had an undescended testicle. It's not a topic you talk about until, guess what, you're married and you're trying to have kids. And somehow you're going to call mum and find out, what did they do to me when I was 5? Right? Don't find that out till later. STDs, whether we like it or not, sexually transmitted diseases are here. Those of us who have gone through this stage of life, you have to be careful, you know, and therefore you can actually pay the price for certain things that you did earlier. Genetic diseases, well, there are not many that we can talk about, but I'll give you a quick story if I have time, but of a man who saw me at 23, no sperm, found out he had no vas deferens, the tube that sperm goes through, and I told him he had a cystic fibrosis mutation, okay? And then I told him, do you have pancreatitis? Do you have gut problems? And he goes, yeah, you know what, I was labelled as an alcoholic at 16. because I always got pancreatitis, which is where it comes from often, is alcohol use. And they called me a dysfunctional child and not dysfunctional, what's it, a delinquent. And he started crying in my office. And they said, my mum always knew I didn't drink. I said, no, you're right. Because guess what? You walked in because of infertility. I've just now answered the whole of the rest of your previous life, which is he had cystic fibrosis. Does it happen a lot? I see enough of it. Let's put it that way. I see about 2 of these a month. And that may not sound like a lot to anyone, but I'll tell you that that's why we work things up. All right? Blockages. And I'm not talking about vasectomies, but that's one of them. That's a cause of infertility. But I'm talking about infections, trauma. I just fixed a guy with microsurgery last week, in fact, who, it's a great story, and I hope he's not here, so I can say this, and it's also HIPAA still confined. But his girlfriend threw a book at him at college. Nailed him in the nuts. And guess what? He's paid the price ever since, and he's with a new partner, and I don't know what he did to deserve a book in the nuts, but it was an unfortunate sports injury. So let's talk about something more relevant. Guys, we go in playing sports, we don't wear a cup, guess what? You get nailed down there, and next thing you know, 10 years later, you're paying the price. And you're wondering why you don't have sperm. I've written about that, sports injuries and male infertility. It's a real problem, and I'm trying to educate kids at a young age, even at the age of 10, when they go to their first games and stuff, that they're wearing a cup. I call it the knock-knock test. I haven't been arrested yet, son. So, this was a study written by a friend of mine, but just to highlight, picked up prostate cancer, testicular cancer, diabetes. If I haven't sold it to you yet, that's why guy needs to be evaluated. Infertility is starting to fit in now with earlier diagnosis with prostate cancer. That's been shown now. Even detection of testicular cancer is higher in men with infertility, and that's why. Because what happens, sometimes being here and being evaluated as a guy is the first time you've actually seen a doctor since you're a kid. There's a gap, probably from the time you leave your parents' home or otherwise, to the time you get married and your wife's sending you to the doctor. There's a gap of about, I would say, nearly sometimes 15 years. 15 years, right? And we're all bad like that. I didn't go to the doctor till I was 35. But the fact of the matter is, my wife made me. And that's really what I have to say. So guys, you're in here because your wife's dragging you, right? But the fact of the matter is, shouldn't, right? It shouldn't be. And that's my long-term mission for you, is to tell the guys it's okay to be vulnerable, it's okay to be checked out, and it's okay to admit you're human, right? We're not the hunter-gatherers like we were in the caveman era. We have to realize life has changed, but genetically we haven't, and we still think like that. That's the testosterone affecting us. So the message, I'm already speaking to the choir because you're here. All right, it's the message to those who don't walk in the door. I'm going to jump past this slide just because it shows you all the different causes of male infertility, but it's not really relevant. And I've already spoken about this. You need to be evaluated for your own health. I'm a male specialist. I love my gynecologists because the ones who specialize in this field will make an effort on the guys, but they'll send them and should send them to a male specialist. It doesn't have to be me, it doesn't have to be a specialist, a urologist, let's say, or even an internist who's going to examine you, take a good history, figure out even the social history about what's making you guys tick. As most of us know in this field, we're not just MDs, we become counselors. All right? I really try to understand what's making the couple tick, and unfortunately sometimes I get too close and the ladies especially start crying because I nail it, and I try to figure out what's the dynamics of that relationship, what's really the end game. As Nicole said, you have to have plan A, B, C. How far do you want to go? How far do you want to go? And more importantly, I have an MBA. I feel like sometimes I'm a financial counselor. How much can you afford to go? Right? Pretty sad statement. I hate that. I hate that. Because it should be a matter of what's best for you that you think medically we can do, not what you can afford. So there's my other soapbox message. So some of this stuff, many of you may have tried again, optimizing natural conception. Just to put it into perspective, 85% of couples will achieve a pregnancy in the first year. In the remaining 15%, about half of them will conceive naturally on their own in the second year, which is why the European definition is 2 years, not 1 year. If you have a mandate, you want to maximize that natural time before government or whatever covers it. So That's why. But in this country, it's 1 year, as we talked about. All right, something that the birds and the bees that you think you learn in high school, or in middle school, or even elementary school nowadays, is timing and frequency. All right, if a man has a normal sperm count, technically you could have intercourse every day. But if there's a little decrease in counts, it should be every other day. Other issues that we often talk about, the plastic cup phenomenon, right? Where how many days do we have to wait to get a semen analysis? The latest data, not to again give you the statistics, but it's actually now 3 days by definition. And it should be 2 or 3 semen analyses to give you an average, because a guy's analysis will be up and down. So when you're dealing with a moving target, literally in terms of a number, and having a tech measure, anyone who's done any math basically knows that you can't rely on one. It's an average. And unfortunately it's a bad number because it varies so much day to day on a guy that it's important to at least make sure, and the empowerment, to empower you, you have to make sure that you know that what you're dealing with is as close to accurate. I've had guys up, I've had guys in the same next week down. And so you're like, which one? So I call it a tiebreaker. You need a tiebreaker to know which way around it is. What else? Timing, the fertile window. In some of the packets I've given, unfortunately I don't have it in every one. It's a nice little summary about natural conception and timing every other day, starting 6 days before mid-cycle. But if you don't know when mid-cycle is, talk to the gynecologists, talk to them about how to figure that out. Maybe it's not. Maybe you're not regular, and therefore that's part of the problem, and that becomes a female factor. Well, when I take a history and some of the stuff that you guys know when you walk in, have you been pregnant before? Is it primary, is it secondary, as we call it? Has your partner, meaning in my case it's usually the wife, of course, is meaning the partner, had children before? How do I know that the plumbing works? How do I know everything works? Well, if you've had a kid before, that's usually somewhat helpful. Have you had miscarriages? Have you not had miscarriages? Have you had terminations and stuff like that? And how long ago was that? Previous evaluations and treatments, that's pretty obvious really. Illnesses and medication history, sexual history, etc., etc. And so medical therapy, well, first of all, educating the patients. Timing. Don't use lubricants. Why? Because they're all bad except for one. And I don't even have shares in this company, and I must be saying it every time I see a patient. There's one called Pre-Seed. Actually, CVS carries it now. It's the only validated lubricant that's out on the market that has been shown not to kill sperm. All right? KY is bad. Astroglide is bad. Bad. All right? Most of them except for Pre-Seed right now. Unhealthy lifestyle. Well, these are some things that you, again, through the lay press, should be aware of. We'll talk about excess alcohol. Yeah, if you binge drink, or you drink a lot that you know you're hurting muscle-wise, you get a hangover effect, guess what? The boys are also hurting down there. All right? So you need to make sure that you don't do the binging. A little bit of alcohol here and there. You're not here to be, a choir boy or anything in the perfect life and know nothing. You can drink a little bit, you can smoke a little bit. Ideally, smoking should not do any of, actually. But a little alcohol here and there is not a big issue. The marijuana, people, it's like a confessional when they come into your office. They'll tell you what they won't tell anyone else. And I'm like, yeah, guess what? Anything smoking related is usually bad. Stop. Period. Little alcohol, probably not as much. Weight, it's very true. Weight is a problem because of BMI, because of the weight ratio that one has, about the hormonal abnormalities that can create. And heat. If it's all kind of buried down there, then it will cause a heat problem. Chronic stress. Tell me one person in this room that doesn't have chronic stress. That is a problem. Infertility is theoretically increasing over the last 20, 30 years. Some of it's because we drink out of bottles, by the way. Plastic bottles, that's the latest thing. All right. Microwaves, all of this bad stuff. Stress, sleeping, not having enough sleep, thinking about money and jobs and lack of vacation time. Why do you think all these stories you hear about, anecdotal stories of couples getting pregnant on vacation? Right? They are stories, there's not a huge amount of science behind it. But the point of it is, it happens because you just get in the zone. All right? And you just de-stress, and it happens for some couples. And we all know stories like that. Preventing and treating infections, endocrine problems, management of medications. We'll talk about medications in a little bit. So as I said, it's very important to get a good history. Talk about their aspirations when they're there a year. Can you wait longer? Can you not wait longer? How far do you want to go? All important. Lubricants we talked about. Heat. Let me give you the myth buster on that. All right? Heat is real, but it's not real in every occasion. All right? Hot tubs, bathtubs, real. Boxers or briefs, not real. Now, if you guys are wearing tight spandex right now, probably not a good idea either. But all right. So the true heat thing, it can happen with tight underwear, but most of the people I know don't wear those tight ones like they do sometimes in Europe. But no, that's being facetious. But the point is that heat does matter. And a guy, just as simple as it was, I've got bad back, my chiropractor told me to have hot baths, and next thing you know, they're in the office with a low sperm count. Stop the hot bath, sperm count comes up, and hey presto, they're back on IUI. Right? They were thinking of IVF, but they're on IUI. So what is, again, my role? My role is to get you guys and couples pregnant naturally, like all of us should be, but it's also to make the situation, from a male standpoint, better, that you're successful with ART, assisted reproductive technology, whether it be IUI or IVF. People don't always understand that, but that is my mission, is to make the quality so you do less and succeed first time, hopefully. And some of that is not so obvious when you look at a number. All right? It's some of these little things that matter, that all of a sudden you didn't have to do 2 cycles of IVF. You did 1. You had great embryo quality, and you've got some to spare if you wanted to go through a second time of embryo transfer later on. So those are the things where I kind of try to get people to understand. I'm trying to shift the curve to IUI to natural, or IVF to IUI, and really good IVF. Right? That's where the complement between a male specialist and a female specialist really does work well together. It's not competition, which is sometimes a problem, where it's viewed that way. All right, smoking. I don't even have to say much more about smoking. You all know it's bad for everything, but so is chewing. All right. Again, guys sometimes have to get off that. So I sell them a different way. You've seen some of the CDC commercials about smoking. Aren't they horrific right now? About trachs and women's, lying in bed. I just saw that last night. I'm like, yeah, because guess what? I should now show a guy chewing tobacco with half his face missing. All right. I don't know. Most nowadays in the US, I don't have to sell this very hard. All right. But even if you have a normal sperm count and you smoke, this is a problem. All right. This is a problem. So, because of things called DNA fragmentation. All right, alcohol, we talked about that, controversial, but again, it changes a few distribution issues. Weight, we've basically talked about that too. Obesity is a reversible cause for male infertility. People who've had bariatric surgery have shown a shift in their sperm counts afterwards and actually got pregnant. Medications. Now, young people don't often have many medications as a rule, but fertility is not just an 18 to 30 age group anymore. It's a 40 to 50 to 60 age group too. And the issues become one of trying to track down certain medications, and here's one of them which somehow people don't always know about, but some blood pressure pills like calcium channel blockers are a problem. Some other medications, unfortunately I see people after chemotherapy, that's a problem. And here's another one that's becoming a real problem, testosterone. So a couple goes into a doctor, primary care doctor or whoever, and they're smart enough to get the male evaluated and they check a testosterone. Oh, your testosterone level's low. You need to, that's the problem. That's why the sperm count's low. Here, take some of this low T treatment, the testosterone. Well, guess what, guys? Unfortunately, and ladies, it's a contraceptive. All right? I have about 10%, just under 10% of my practice, just looked at our numbers, who have been on medical testosterone, right? That's a problem, because you weren't infertile until you got put on the drug, right? So please, again, to empower yourself, just because you have a low testosterone doesn't mean it's the cause of infertility. It may be a stress event, it may be a problem unrelated, and so therefore, again, it's an issue where you need to, again, be empowered not to be put on a drug. But again, you're looking at the doctor in his white coat or her white coat, and you trust them, and I would hope that's happening most of the time. But what happens is, just like Nicole said, it's okay, you kind of get these things from the internet, you go, hold on, I should question this. Yeah, you really should. And the anabolic steroid use, the big muscly guy with small testicles, as I call him. Men are in denial when they're doing that. All right, the fact of life is, they know it, they've looked at it, they've got the drugs off the black market, they'll get married, and actually you can catch them out. And I have caught guys out. They're there with their wives, they're being worked up, They say, and they swear on the Bible almost, that they stopped it until you check their blood tests. And you have to call them a schmuck for it. You know, I mean, it's just not right. Poor wife's going ballistic trying to get her HSGs done, and, you know, and it's awful. But you then have to kick their habit, which is another big problem. All right? An evaluation of exam. Right, sorry guys, I didn't mean to do this to you, but throwing the testicle and scrotum up there is, what is wrong? That's testis cancer right here. All right? Either from testis cancer or a history of testicular cancer. That's why we also live. This is a much more common problem that's got a lot of controversy to it, which really it shouldn't have. Varicoceles, the so-called bag of worms. It's the veins of the scrotum that act like a heating blanket, and we as urologists have shot ourselves in the foot. Why? Because we've overcalled it on many times, and so the data, the kind of studies that show that it is effective when you fix these things, looks a little bit muddy, but really it does work, and I can give you a number of attestations to show that that does. But here's the bottom line for the guys. It's a common problem when you see them in the clinic. 40% of infertile patients have one of these veins that are kind of causing the heat blanket effect. And they do get better. Again, I've taken guys with no sperm and got sperm back in their semen that they could do IVF. I've taken people from IVF to IUI, and I've taken IUI to natural. And so all of these things are, again, why the man is so important in being evaluated. We need to maximize the situation for the couple. So that's what we do. We go from hot to cool. All right? That's what we do. We do it surgically. We do it through X-ray department does it through embolization, which is where they kind of throw coils down into that vein through it like as if you're getting a cardiac cath in through the groin. And that's where we're standing. Now, I don't know what the dynamics of the group and what their problems are, and I'm very happy to take questions, and if you're willing to talk to me in public or even in private, that's fine. But I thought I'd bring this one up too, because it's becoming a more common problem. 520,000 plus vasectomies done in this country. About 6 to maybe up to 10% of vasectomy people want them undone. New relationship, death of a child, and go on. But I think the important thing is to know the balance of choices. Before 1992, we only had one choice, which was a vas reverse, and I do about 5 of these a month. So you can see how, if you become a specialist, things do gravitate to you. But I was always taught by a very ethical urologist, is now we have choices. Now we have choices. The choices are vas reversal or in vitro with sperm recovery from a biopsy. You tell, and like, again, I'm going to tell you what Nicole said, and I so much appreciate what she said. It's your choice. When it comes to secondary reasons, it is your choice. There are some biases that are biological, age of the woman, how many years out from your vasectomy you are. That's fine, and I'll give you my biases. But as a good urologist, and I work with the IVF groups in town, especially at KU with Sasha in the back, you know, it's important to just lay it on the table. You will manipulate it however you want as a patient and choose which one fits you. And that's your choice. And that's the liberal side of my job, is to let you do what you want. But you're going to have, you know, we want to guide you as best as we can. But these are the 5 choices when you have a vasectomy. Reverse it, do IVF, use donor sperm, adopt, or do nothing. Sometimes they have the Brady Bunch and 5 kids. You're like, what are you thinking right now? But again, the power of biology is when you're a new couple, something incredibly basic happens. You somehow want that union and you want a baby together. Irrelevant to the fact there are 10 kids in the background, right, sometimes. And unfortunately I saw a very nice couple yesterday, and it was tragic. He was 55, his partner was 40. He was getting chemo. He'd had a vasectomy 30 years ago. But somehow they lost their window before he got diagnosed with cancer to try to help them have her first baby. They met at 32. And it's so tragic. They left it, and then he got cancer, now he's on chemo, and it's just like, okay, there are too many variables today. You need to take care of you need to take care of your wife, you need to just sort your life out and not worry about the next step until it happens. So these are the things that counselling becomes very important. And I spend nearly 45 minutes with couples like this to explain it to them. Why does it? It's not because it's no hope doing a vas reversal. If I believed that, I would have stopped doing them. But basically, nationally, around about 9 years, pregnancy rate from a vas reversal is about 44%. Well, nationally, it's around about here for IVF. Nationally, I say. So, but there are biases when you think about 76% pregnancy rate from a vasectomy reversal when it's under 3 years out. But you have to also remember that doesn't tell you how old the wife is. If a wife is 41 and you need to wait a year from after a VAS reversal, I'm going to tell them, listen, move forward and do IVF. It might be quicker, it may not have, again, the egg quality isn't a concern, but that's the bottom line on that. But I decided not to show pictures about how we recover sperm. That's just too traumatic for any man to watch and see, so I left that blank. But basically, that's my talk, and I went through it very briefly. I know some of this is very basic, but I didn't know who I would be talking to, because again, it's so individual about what matters to you. What do you want me to talk about for the next few minutes in terms of questions? I can take everything from vitamins to, you name it, surgery, whatever you want. And again, if it exposes you, you have to feel comfortable in a group surrounding to speak about it. If you don't, just get me aside for a few minutes and I'll be happy to talk to you. But do you guys have any questions? Obviously it's a small group, in a close group, but that's part of the mission, right? This room should have been full. But there are too many things going on at the same time.
Well, what about the vitamins?
Okay, so here's the scoop on vitamins. I actually wrote the section on the practice guidelines for the National Society on this with one of my other colleagues, because it's all over the place. But what's the trend? First of all, most of them won't hurt you, other than giving you a wallet biopsy sometimes, all right? You don't want a wallet biopsy. So the fertile aids and stuff out there, they're all good. Because you have to figure out, if I bought, and here's my very simple answer to you. I call it vitamin A through F. There isn't really an F, by the way, but you'll hear, because vitamin A through E, everyone knows about those. F is folic acid, it's not a vitamin. But folic acid, people don't realize, is the building block for DNA. Right? DNA is what we are. I'm a molecular urologist. Everything I do, I can't see, right? Nor can you. Right? So it's all in the fluid, and it's all under the microscope, and the bottom line is that's hard to convey to patients. I'm talking about stuff that is surreal and so kind of can't even put finger on it, so to speak. You know what I mean? So folic acid is a building block for DNA. Most people don't know what DNA is. So try explaining that to a person who did it in middle school, high school, but have forgotten what even that means. So as I describe it, and I'm not trying to be belittling to anyone, but let me explain what DNA is. So your whole life and your whole being is a playbook, right? And every page of that's on there, that's writing on it, is your DNA. And the little chromosomes are pages and pages, chapters, if you will. And within each chapter, there are letters and there's words. Everything is the building block of DNA within that playbook, right? So what happens is you want to make sure when you do your word check, right, that all that DNA is in the right order and it actually doesn't have spelling mistake. That's what folic acid does. It's actually the letters on the page. Between folic acid, vitamin B6, B12, it's how you actually put the words on the page. All right. So that in my heart, and there's more data. I can have to say heart because there's not really great data on it. But folic acid, just like for women, is crucial. Right? I don't care if the papers don't say it yet. They will. There's a huge National Institute of Health study that's about to start on folic acid. But I've been doing it for years. I'm even doing it more now. Right? I truly believe that folic acid is the huge part that we miss as guys. Women have known it for years. It's in your prenatals. It's everywhere. Because you've all heard about neural tube defects and folic acid. So I'm like, all right, well, they get it. Well, why shouldn't we as guys be doing it? It doesn't hurt. Guess what? It's in greens. And if you live in the Midwest and you're a meat and potato kind of guy, you ain't getting folic acid. Right? So you better take it in a pill form. So that's folic acid. Vitamin E, A through E. Everything I'm about to tell you about this has got science behind it. A, involved in sperm making. B, making DNA. C, antioxidant. So for all the things that we do with orange juice, and it's mainly orange juice, of course, that is, again, the way our bodies fight infection, break down products of oxygen, the thing we're breathing. It's what helps protect our body. It's like being the TSA at the airport. It's like the checks and balances. That's what helps us kind of stop things getting broken down. So is vitamin E. That's another antioxidant. All of this has been oversold in the lay press, but it's real. I mean, whether you drink pomegranate juice or not, it doesn't matter. But vitamin A, C and E, that's what I did in my research at Cleveland Clinic. It's real, but the data's a bit mixed in how well and how effective it is. And it can't hurt. You can overdo certain ones. E you can overdo. D you can overdo because they're fat soluble and you have to be very careful for the liver. But at the doses they're recommending nowadays, it's not dangerous. Okay? So that's A, B, C, and E. Now D, I have a personal love of vitamin D. Why? Because that is my research. But vitamin D is now rearing its head as a common problem. As you all know, it's an epidemic in this country. We put sun cream on, we don't go in the sun, we don't drink maybe enough milk, we don't do this, we don't do that. So vitamin D is a problem in this country. I'm surprised we're not getting rickets in children nowadays, which is an old disease that it's rearing its head again because we don't feed our kids enough and we put sunscreen, which is important. But vitamin D deficiency has been shown to have issues on sperm and general men's health. And so, is it the holy grail? You come in and see me, you spend all that time driving, and you sit in my office and you wait for 20 minutes to see me, and then all I tell you is going to take vitamins. Wow, was that worth it? Well, no, it isn't. You're right. But the thing that I hope to be doing is figuring out your story. That's all of us do in this profession, is trying to figure out how do we tailor this treatment to you. And what are you doing wrong? I've had the heat thing, I've had the lubricant thing, and all of a sudden you feel really good about doing nothing. All right? Isn't that great? What a great job mine have sometimes. Sometimes it's as simple as that, and the next thing you know, they're pregnant. And all of a sudden it was for free. For free. No assisted reproduction, and that's one of the most powerful things I could ever do. No offense to my RE friends in the back. But my job is definitely to make it free, because that's what you want. You want to get pregnant naturally and be on your way. That's the bottom line. And so if I can do something as simple as that, but give you the background as to why it's used, that's what I'm going to do. The other thing that guys now are taking a lot of, and it doesn't work that well, but is Clomid. Clomid is the way that women boost their ovulation. Well, guess what? Like I said, there's nothing different between the men and women other than their testicles and their ovaries. Well, a few other appendages, but you know what I mean. But the point is that if they work the same way, why doesn't Clomid work in guys? Well, it does, but not really, because it's, there's some subtleties to how sperm get made and stuff. But Clomid, I give it all the time. Why? Because some guys have low testosterone. But you can't put them on testosterone. So you're trying to help their libido, you're trying to help their, general sense of energy, but you don't want to give them something that's bad for them. So that's another empiric. I didn't have a whole section. I had a whole thing on empiric, but I decided to not talk about it because it would take another 40 minutes. But the bottom line is that those are simple. They're not. Now, there's not a lot of things. Otherwise, if that was the case, I'd fix everybody and they wouldn't need assistance. But that's not true, because 60% of male factor is unexplained. That is the world I live in at the university that I'm trying to help figure out the next step. What's it going to be mainly? It's going to be hormonal or it's going to be genetic. Right? There are only 2 genetic tests, 3 actually. Cystic fibrosis, the X and the Y, and we look at the Y chromosome, the male chromosome itself. That explains about 10 to 20% of men with no sperm or low sperm. Right? That doesn't explain everyone. So the pragmatic or the practical stuff that I want to pass on to you is, I know sometimes that it seems unexplained and there's no answer and you move forward to do in vitro. But my job is to facilitate that being as successful as possible. Not just me, but I'm just saying me because that's what I do. It could be another urologist, but they have not as much vested interest in you because they don't do that all the time like I do. But the point is, the job is to make the situation better all round. To also give those guys who have low sperm counts and women whose partner has low sperm count, to understand what they're getting themselves in for. All right? Not just IVF, I mean potentially genetic transmission, what their children could have problems with, and to be very honest with you, we don't really know the answer to that question. ICSI doesn't cause problems as far as they've shown on very large studies in terms of birth defects. We don't think there's anything wrong on that level. But who knows later on of anything we do, whether it be even just male factor on their own health, male factor on their child's health, we don't know. And I think that's the honest part of the statement, is you guys have to be empowered to know how far do you want to go. And it's that, if you pardon the phrase, it's that selfish gene instinct, which is naturally you want to have a child, you want to have a child, you want to have a child. And I totally get it. But sometimes I've taken men with known genetic disorders and women who their partners, and they still want to have children. All right? And you have to be very careful that they're not just so overpowered by the desire to have a child that they forget what they could have. Cystic fibrosis is a classic example. The guy who has that condition I told you about has the gene, but you must make sure the woman gets checked out so you don't transmit a real disease to the offspring. You know, it's wonderful to have a child, and it's the most powerful feeling in the world. It's hard to raise a special needs child, period. All right? You will love them, you'll do everything, but it is stressful, and that's going to be an obvious statement. But that therefore, sometimes not seeing the big picture, as again Nicole said, you've got to see the big picture. Where do you want to end up, and how realistic is it for you? And now we have the beauty of pre-implantation genetic diagnosis. It's some of the beauties of assisted reproduction that we have. If you have a known disorder, we can test for it. It's hard and it's expensive. I mean, it's not like, you know, oh, let's just do a quick blood test. Sure, it's one of the cells from the embryo, all right? And it has to be a quick turnaround, so before you put that back in 3 to 5 days afterwards. So those are the issues that if you walk into this knowing a disease, you have a better decision making as to how you walk out of it, all right? If I tell you I can find sperm out of men who have no sperm in their semen, not blockages, but otherwise, it's called microdissection. About 50% I can find sperm in those guys. That's fragile sperm, all right? And we don't know why sometimes, especially if they haven't done the genetics, so you should, what we're doing in transferring that to the egg. But I will always, as best as I can, convince couples to try to get that blood test done, because it's important, because one of the things on the Y chromosome has 100% shown in the child, especially even in animals and even in children now that have been born since '92. But they won't have children either. Tell me, what kind of legacy is that? What kind of legacy is that? But I can't get on my soapbox enough because I don't have all the facts. I don't have all the data to give you that this is the answer to your problem. And that's very difficult for me. So if anyone asked me why I'm in the university, it's because I don't know how to answer it, and therefore I have to do something new, you know, the next frontier. That's my next one, is to try to help. And unfortunately it's too late for you guys or whoever's trying, but I don't know how else to do it. You know, how else does anyone do it? You help the next generation, and you help your colleague or partner or next person who walks in the door with infertility. I helped find that answer out, right? That's what the guys and ladies in this room end up being, is somewhere along the line. You hope that you transmit that in a support group, or you transmit that in a oh, I'm willing to give blood for something and help next generation out. So that's a long answer to your question, because it really was the other half of the talk, but I stopped because I knew I didn't have enough time. But are there any other questions?
Is part of that, and you kind of hit on it there, but I always heard male children born through IVF have a higher rate of male infertility?
That is in certain conditions, but they especially in the Y chromosome deletion, that's been shown. At least, see, these kids they're not old enough to have their own kids yet, or even do a semen analysis.
Right.
Really, the Y chromosome microdeletion has only been done since like 2001. So what was that, 2000? So they're only 10, the best, right? They're only 10 years old. So that's an important thing. But the final thing I wanted to say, and you reminded me, is even in a situation, and Sasha may talk about this, so it's a good segue to her, is sometimes recurrent miscarriages or poor implantation or poor fertilization is due to things that are in the sperm or from the sperm that even with a normal sperm count you can't explain. DNA fragmentation is a classic example of that. All right? There are ways we can check it. It's a little bit of an expensive test, but we can. But the treatment is, guess what? The vitamins and the folic acid. That's the treatment. So why do the test? So just to answer one of my earlier questions or thoughts was, if you know the treatment's cheap, why do the test? Well, you know, as a scientist, I always want to know what I'm doing, whether I'm making it better or making it not doing anything. But that's been shown on a sperm. I can go on and on and on about things that can happen even in a normal sperm count. But that's difficult to translate to today, to you, to non-science. It's a fact of what are you going to do today? What am I going to do tomorrow? How am I going to get treated tomorrow? And like I said, sometimes it's as simple as changing the way you do things. Sometimes it's the lubricants, it's this and that. But sometimes, and I've heard from one couple out there that I've been very gracious enough to realize that, you know, she's pregnant. And her IVF cycle went so much better than her last one because I made some changes. I didn't know that until I walked in the door today, but the fact is it's powerful and it's beautiful and it's great for me to hear those stories. But did I avoid IVF as a male specialist? No, I didn't. Do we work hand in hand? 200%. And I work with anybody in town, I don't care, because I want to help the guy. I want to help the couple. You know, that's the bottom line, is I'm very fortunate because I'm in a field I don't have to compete. I'm a male specialist who works just at a university, that's the guy. But, and so, any other questions? Yes?
When you were talking about the studying the DNA or
Yeah.
testing for
Yeah.
microdeletion,
Yeah.
I actually was diagnosed with sertoli
Only? So that's the, yeah,
and that's one of your
right.
genetic disorders
Absolutely.
you
You
referred
would
to.
absolutely, this would be a situation where, first of all, you're not written off yet. It's a difficult story. But when sertoli only happens, which basically is no production in the cells, you could have one of the Y chromosome microdeletions. If you had the particular one, I would advise you, not to do it. If you had a different kind of microdeletion, I may not find sperm. But the point is then, what do you do in your situation where you're talking about microdissection, looking for sperm, doing in vitro with the sperm if I find it 30 to 50% of the time, but
So
always
it's
having a
that
donor
high. I
backup.
was told that it wasn't that high. I was told that like maybe 20% in certain cases.
No, actually it's up to, I'm even counting it low because in my hands it's about 30 to 50%. In the guy in the national arena who does this is a dear friend of mine at Cornell, he's actually on the international arena, he says 70%. I can't quote 70%. I can't quote 70%. 50% is the best I can quote. But the bottom line is that still leaves 50% I can't find sperm in. Right? So you have to remember, it's very binary.
Sure.
And that's the problem, is when you walk in the door, either it's there or it's not.
Yeah.
Period. All right? And so I always recommend that when we go down that roller coaster, that you have donor sperm as a backup.
Yeah, that's what we've decided to do.
Yeah.
Also, had the doctor wanted to do another blood test to determine where the microdeletion was, and I was just curious why you would want to do that. I mean, at this point, it's
It is. If you're moving on to donor, it's probably not relevant.
okay.
Now, however, what else matters though? The X and the Y might matter to you. Why? Because like I didn't go into Klinefelter syndrome,
Mhm.
but there's a pre-diabetic risk, the thyroid risk for you as you sit there,
Mhm.
that you need to know whether you're that person. So if it were the choice of which one I would have chosen, it would have been the X and the Y,
Okay.
ironically. But the point of that is because, again, as an MBA, not an MD, I'm telling you which one is most cost effective to you for your health. Because again, the Y chromosome microdeletion doesn't matter, relevant because it's only relevant to your offspring and finding sperm.
Yeah.
You've moved on.
So it would just be for health purposes to see if I.
And that's the X and the Y. And otherwise, I'll just give you the men's health talk, which is keep checking yourself out, make sure you get your blood test for your testosterone, do the men's thing, like make sure you do your doctor, go and see your cholesterol and your diabetic risk. Those are classic, normal things I should tell you to do anyway, right? Okay, thank you.
We want to thank Dr. Najia for coming in and doing your speech on male infertility. And we're going to take a 10-minute break, and then you'll just go to your next session, and you can just follow the signs wherever you're at, and that'll start at 11:15. So you can go and if you haven't registered